All right, it is time to start a new chapter, start a new unit, and this is going to be the last unit of the semester for my students. This is going to be the material for the final regular test. We still have a comprehensive final exam, but the last regular test. And so it's going to cover two chapters, one chapter about psychological disorders and one about therapy. Now, for both of these chapters, I do have to give very important disclaimers. Students often have high interest in these chapters. These are the ones that typically most students, if they're looking forward to anything at all about taking Psych 101, they're excited about these topics. Unfortunately, sometimes students will overestimate the degree of expertise or competence that they will get from having had a single chapter covered in a single introductory class in terms of making them qualified to do things like diagnose people or recommend therapies and things like that. I need to make it clear that you absolutely will not be qualified to diagnose your friends and family or to make therapy recommendations and things like that. I'm going to be teaching you some basic definitions. I'm going to familiarize you with general terms and things that are relevant to these fields. Now, you may learn enough to know that you need to ask for more information. Maybe you are concerned that a family member might have one of these disorders, for example. And there are resources out there where you can ask people who are qualified to make those decisions. For students on campus, we have counseling services, student counseling services. You can contact them with concerns about yourself, or at least they can make recommendations. For family members, there are various resources online, hotlines, professionals in your area, depending on where you are. There may be more or less professionals available that you can contact, but I just want to make it very clear, you will not be able to diagnose anybody. You will not have that level of expertise. All right, you can tell why I have to bring that up, right? People have done it in the past. All right, so let's get started with the chapter is labeled Psychological Disorders. Now, we have a class on campus which is labeled Abnormal Psychology, and your book describes this field of study as psychopathology. We're talking about a lot of similar stuff here. So we're not going to use the term abnormal psychology, even though the course on campus still has that title, because we're kind of getting away from that term. But psychopathology. What is psychopathology? And it's very general. The scientific study of mental or psychological disorders. Okay, good starting point. What's a psychological disorder? Or, as your book also calls it, a mental disorder. That is a clinically significant disturbance, I'll say more about that wording, a clinically significant disturbance in a person's thoughts, emotions, or behavior that reflects dysfunction in mental functioning. Very broad, huh? A lot of things can fall under this category. Now, clinically significant. You may have symptoms of a particular psychological disorder. That does not mean you would actually be diagnosed with a particular disorder. There are some symptoms that are almost widely experienced, but they have to get to a certain point or interfere with your life enough that it would be considered part of a disorder. Classic example that I'd like to give when I am teaching in person, I'll say, okay, let's just try something. Raise your hand if you've ever been sad. And typically, everybody in the class raises their hand. And that sometimes I'll have that one person who doesn't, and I'm like, really? How did you get away with that? But then I'll ask about some of the other symptoms of depression is what I'm getting at here. And they've experienced one of the other ones. I say, okay, now, just because you've experienced sadness does not mean you've ever had clinically significant depression or that someone could diagnose you with a depressive disorder. All right, so we always have to remember there's a difference between clinically diagnosable disorders and what we might call subclinical symptoms. You might have symptoms, you might have mild symptoms, you might have fleeting symptoms, things like that. The study of these types of disorders is quite complex. It is not a simple, straightforward field at all. One thing that makes things difficult is that a lot of disorders in disorders, you have high degrees of something called comorbidity. What does it mean to have comorbidity? That word morbid, we think, like death and depressing stuff, but comorbidity simply means the presence of two or more disorders in the same person, essentially. That's a condition where a person is diagnosed with two or more psychological disorders. All right, so for example, if someone could be diagnosed with a depressive disorder and an anxiety disorder, right? In that situation, those disorders are comorbid. It is remarkably common for someone to get a diagnosis and have another diagnosis. We should not think that someone can only have one disorder at a time. In fact, my mom recently, I was talking about people in my family because once my son was diagnosed with autism, I started thinking about other people in the family, and I said, I think other people in the family had autism too. They just weren't diagnosed. And I brought up a family member. I was talking to my mom. I'm like, the more and more I think about it, the more I think of good examples that, Mom, she might have had autism too. And my mom's like, she had bipolar disorder. I'm like, oh yeah, I know she was diagnosed with that. And she's like, yeah, so she can't have autism. I was like, it's like, what do you mean? She's like, well, you can't have bipolar disorder and autism. It's like, yeah, you can. Yes, you absolutely can. My mom was one of these people who's under the impression like you have one disorder, or it would be unusual or weird to have more than one disorder. There's some disorders where people who study those disorders, like ADHD is one that I'm familiar with. And ADHD, when they get into it right away, they're like high rates of comorbidity. People with ADHD often have other diagnoses, like, for example, learning disabilities, learning disorders, learning disabilities, depression, anxiety. All right, so that's just a sampling there. All right, so let's remember comorbidity is common. Now, some other issues with the study of disorders, the study of psychopathology, things are complicated. Now, for the purpose of this class, I am going to save time, I'm going to focus on teaching you the different disorders categories. So you can be familiar with what certain major symptoms mean, what certain disorders categories, what those words mean. If you want to know more about this, you should definitely take abnormal psychology, or at another college campus, it might be called something like psychopathology. In those sort of upper level classes, one thing that they're going to cover is the nuance and the complexity with using the system that we have for labeling people. In the textbook that I'm using for class, there is a little bit going over the problems, the problems of labeling, but also the usefulness of labeling. Labels, diagnostic labels, they work well for communication, for one thing. But sometimes they make it seem like people with a certain diagnosis are more similar than they actually are, that it's more like a generalization. And so we have to remember that even within a certain diagnostic category, like pick a category like schizophrenia. Everybody with schizophrenia is not exactly the same, right? There are many, many people with schizophrenia who have a lot of distinction, a lot of diversity with other people. They can be distinguished from other people with schizophrenia, not just be distinguished from people who don't have schizophrenia. So I want you to keep these issues in mind before we go into our first set of disorders. When we talk about specific disorders, we're going to start with anxiety disorders.